I definitely think there is a desperate need for mental health education, mental health awareness, really in particular for the adults in the youth's lives. So especially we're in the midst of a global pandemic over the past couple of years. We've definitely seen an uptick in a lot of mental health challenges, a lot of mental health crises. We've seen increase in suicide rates. We've seen increase in overdoses and of course increased episodes of depression and anxiety. So we're definitely seeing the numbers increasing. Oftentimes we say somebody committed suicide. We try to talk about eradicating that term from our vernacular, and a lot of that has to do with the judgment and the shame that's associated with the word committed. So we, in our country, we commit crimes, we commit sins. So there's already this negative connotation that goes along with this term. And so being able to take as much stigma and shame and discrimination out of the conversations that we're having around suicide and mental health, the more apt people are to have these conversations and the more comfortable and safe people will feel. A really big misconception about suicide is that if we ask the question, if we ask about suicide, we are putting that in their head, when it's actually not accurate. And actually asking the question about suicide can actually be suicide prevention. So a lot of times people will tiptoe around the topic of suicide, but oftentimes for folks who are having those thoughts about suicide, it can be a relief for them to be able to talk about it and be able to talk about it with somebody who is judgment-free and allows the individual to talk and kind of express themselves and not putting judgment on them or any type of assumptions as well. So I think that a lot of what Mental Health First Aid does, it provides skills, but it also helps to develop a mindset as well. It helps to talk about, we talk about de-escalation and some of those reactions we might have and what might be a better way to respond, especially in crisis situations, especially if individual has dealt with traumas. And I think that's kind of the biggest piece too is just being able to destigmatize mental health in a way that we talk about mental health just as we do our physical health.